logged in.
I did. Yeah, I see him. He's muted at the moment.
Okay. I'm present.
So it looks like at the moment I didn't hear Commissioner Norton.
Present.
Oh, there you are. Thank you so much. And then Commissioner Przonski and Commissioner Lewis. Looks like we have quorum, Paul. We're ready to go.
Great.
I'm also here. I didn't hear my name called, but
Holly.
Commissioner Harris. So
Yep.
sorry. Thank you.
Okay.
Great. Do we have anybody signed up for public comment today?
We do actually have 2 people signed up for public comment today, Paul, and I'm going to go in the order that I received the request. So our first one today is Judge Celia Howes from Multnomah County. Are you present, Judge Howes?
Good afternoon. I am present. Are you able to hear me?
Yes, we are, and we welcome your testimony. As a reminder, we have 3 minutes set aside for testimony today for each person.
Thank you. All right. Well, I'll jump right in. Good afternoon. I'm Judge Celia Howes from Multnomah County. I preside over our DUI intensive supervision program. I want to thank the commission for inviting public comment today and for giving me the amount of time allowed, and also for your many years of support for Multnomah County's specialty court programs. I'm here today to ask the commission humbly to allow resubmission of the Multnomah County Specialty Court budgets to the Grant Review Committee. We're asking for resubmission, believing it's the most efficient repair to ensure that the necessary services are ultimately approved for our courts. But please know we do appreciate and would certainly follow any feedback on our approach. It's due to what appears to be an inadvertent clerical error that our budget submission left the Grant Review Committee without the substantive information it needed to approve our treatment services budget. And now our court faces a very real threat to its existence. While our participants would certainly be able to still access clinical services through their providers and insurances, in the next biennium, DISP is set to lose our non-billable treatment supports that are what we need to make our court work. I do want to provide you some important context for what that means to us. Now in its 28th year, DISP is our state's longest running treatment court. We have earned the respect and support of our community partners, including DA Nathan Vasquez, who I see is present at our meeting today. It's through our commitment to evidence-based practices that we have served a critical and reliable public safety function in our community. Our 75% rate of graduation shows that our formula is working. And CJC's own data shows reduced recidivism rates of 25% across all treatment courts in Oregon. And the last look at DISP data showed a 10% recidivism rate. We've been able to employ best practices in our courtrooms with swift and certain responses to participant behavior because we have treatment at our table. Our treatment partners are the experts on our team. They provide timely data on SEMS and are key partners at court staffings and in court sessions. While I and our judges make the final decisions in the courtroom, we rely heavily on input from treatment. They help us understand the precipitating events to unwanted behaviors. They help frame the most impactful response to change behavior, and they shape how we best incentivize progress. Our peer mentors also provide key supports to participants, and we know that most up-to-date research shows how impactful they are in preventing reoccurrence and substance use, improving treatment engagement, and reducing new crimes and use of jail. The loss of these treatment partner supports would mean an unimaginable change to our current operations. And it's really a strain to envision how DISP will continue to meet the Oregon specialty court standards that I know the commission expects of us, and frankly, we expect of ourselves. The other Multnomah County specialty courts are in a similar boat, and we have taken to heart the feedback of the Grant Review Committee. We understand and we appreciate the need for improved submissions on our part. And if you allow us, we will resubmit and undoubtedly provide all of the necessary backup you need to approve our budget. I want you to know that if the commission doesn't ultimately award us this money, I am still going to be here. I believe in what we're doing. These 27 years have made DISP an institution in Multnomah County, and I am proud to be a part of it. A street patrol officer talked to me recently and said to me that in all of his years making DUI arrests, he'd never believed that people could change until he witnessed a DISP graduation. And then told me that what we're doing represents the very best of what the justice system sets out to achieve. And I agree. We are delivering on the commission's mission. We hold offenders accountable, we reduce recidivism, we reduce the use of jail beds, and we change lives. We are really worth the investment, and I believe it wholeheartedly. I do hope you'll consider our request, and thank you.
Thank you, Judge Howe.
The second
yeah, go
person
ahead,
we have
Judy.
signed up today is Kathy Savos, and she is from Volunteers of America.
Great.
Ready for me? Good afternoon. Mr. Chair and members of the Criminal Justice Commission, my name is Kathy Savos, and I serve as the Senior Director of Government Relations at Volunteers of America, Oregon, a longstanding provider of behavioral health services in Multnomah County's STEP, START, and DISP treatment courts. Last summer, I was honored to serve on the legislature's Joint Task Force on Specialty Courts, where we worked collaboratively to develop recommendations for strengthening Oregon's treatment court systems under House Bill 4001. Several of our task force findings and recommendations called out the crucial need to adequately fund treatment services, particularly after the significant funding shortfall last biennium threatened the operation of so many highly successful treatment courts across Oregon. In this coming biennium, treatment services will become even more challenging to sustain in the face of looming Medicaid cuts. I'm here today as part of a unified community voice to respectfully request the Commission's reconsideration of funding for treatment services in Multnomah County, particularly for the DISP court, which has been recommended to receive no funding for treatment services. While the Multnomah County applications may not have fully conveyed the structure of these services, they are active, essential, and reflect the evidence-based practices that drive treatment court success. These treatment court services are critical upfront investment described in each of the Multnomah County DISP, STEP, and START treatment court applications, including intake by diverse and multicultural staff to enroll new participants, apply for Oregon Health Plan, and begin engagement. Pre-engagement coordination and reporting, including culturally responsive mentorship by those with lived experience, case management, transportation, social support, and barrier elimination. These early interventions dramatically improve participant stabilization and treatment success. The entire treatment episode is tracked in SCMS. And lastly, court participation in meetings. Treatment court liaisons play a pivotal evidence-based role in team-based care. They attend court, team meetings, provide progress updates, lab results, and serve as a critical link between treatment and the court. These services are not covered by insurance, but they are essential for treatment providers to implement evidence-based practices and support court participants in achieving lasting recovery. They form the critical infrastructure that keeps participants engaged in treatment and enables meaningful long-term change. Whether or not our agency is selected as a future provider through the procurement process, we have the expertise and responsibility to speak to the values of these services in our community. Multnomah County treatment courts have helped thousands of individuals overcome addiction, secure housing, and contribute meaningfully to our society. If funding for treatment is lost, it will disrupt and contribute to higher costs with unavoidable impacts on public safety. Just as we offer our clients a second chance, we ask the Commission to give these applications a second review and ensure these essential treatment court supports remain funded. Please restore funding for DISP courts treatment services so our community can continue to turn lives around. Thank you for your time and ongoing commitment to public safety and recovery.
Thank you, Ms. Savos. Well, I think this is timely, as the first item on the agenda today is the
Paul,
treatment court. Yeah.
If I can interrupt you really quickly, I did get a
Yes.
message from DA Vasquez asking if he could also make a quick comment.
Okay, I'm fine with that. Go ahead, DA Vasquez.
Thank you so much, Paul. I appreciate that this opportunity to speak today to the Commission. I am here to support the reconsideration of Multnomah County's specialty court grant submission. This is something that throughout my 25 plus years, our specialty courts have done amazing work. As the DA, of course, I've served both in those courts and then recently had the opportunity to kind of go to graduations and see the amazing impact that they have. And I think it's something that's well documented, well seen, that the courts here, particularly in Multnomah County, do a great job of reforming lives. What is also, I think, really critical to that understanding is that those courts provide an invaluable off-ramp for my office to have people go into and to treat them here in the community in Multnomah County, as opposed to seeing them off to prison, which is something that we look for every opportunity to try to avoid. And so that is why looking at these budgets and maintaining these specialty courts is so vital and critical, not just for Multnomah County, for the citizens, the public, and for those individual people that find themselves in the specialty court, but for the state as a whole, because of really the volume of individuals that we're dealing with that could potentially end up in our correctional facility, that we're really trying to find all different ways we can to avoid that, and through a healthy way, which benefits the individual and the community. So that's why I'm here today, to urge that, because I too have been there and seen how they have deeply impacted and changed lives to help the individuals, the community as a whole, and really the state. So with that, thank you so much for the time and the opportunity to speak here today.
Yes, well, thank you, DA Vasquez, and all of the individuals who provided testimony today. Anybody else, Jenny, that we have signed up or that is asked to provide public comment?
I don't have any more requests at this time.
Okay, well, let's dive right in. The treatment court grant award decisions are the first item on the agenda. And given the concern about the Multnomah County District Court, I think it's important that we have are grounded in the grant review committee's process and the staff recommendation. So with that, Adeline, if you want to walk us through the final award decisions that came out of the grant review committee, we look forward to hearing. Is Adeline with us? It looks like Rep. Lewis just joined as well. Okay, we can hear you.
And hopefully you can see.
Yes, we've got the first slide up. Yep.
Nothing like the biggest meeting of the program of the biennium to have tech issues. Hello, everyone. Thanks so much for having me. For the record, and for the commissioners I have not met yet, my name is Adeline Padlina, and I am the Treatment Court Grant Program Coordinator. And as expected, today we are going to discuss the final award recommendations that are coming to you from the Grant Review Committee, and then you all are going to make those decisions for the 2025-2027 Treatment Court Grant Program. As we get started, I do think it's really helpful to just remind everyone what everyone's roles are and what has kind of gone into this process before you all are seeing it today. So first and foremost, it starts with, of course, the applicants themselves. I think it's important to note that this is the most applicants we've ever had for this program. We had 59 applicants, so 59 different treatment courts from all across the state. And then it goes to staff. So I am the one who often comes to you and you see my face, but I just want to take a moment to shout out the incredible team at the CJC. We literally put at least sweat and maybe some tears into it. I can't speak to blood, but there's a lot of effort that goes into all of the creation of these programs, that goes into going over the data. There's a huge amount of data that we look at and that we bring to you all. So as staff, we're reviewing the applications, making sure they're complete. We're going over them, we're analyzing them, and then we provide funding recommendations to the GRC. This happened a couple weeks ago. And the GRC, who I'll introduce via slide in the next slide, they worked really hard. It was, in fact, a day and a half. It was a long meeting to discuss these applications collaboratively and then to provide the final funding recommendations, that we're bringing to you today. And then finally, it gets to you all, the Criminal Justice Commission. So we are asking today that you consider these funding recommendations that have been made by the Grant Review Committee, and then ultimately make that funding decision on 59 applications. Now, I heard in her public testimony, Ms. Savos recognized the Specialty Court Task Force. I'm really proud to say we've done a lot of work on creating a really awesome GRC. Shout out if any of them are watching. And many of them were also on that task force. We have wide representation. There's a judge, there's a district attorney, there's people that work in and around treatment courts that all met for those 2 days to bring a lot of experience and a lot of guidance to this process. But really, my guess is what you all want to hear about is money, right? That's why we're all here today. So let's do a little breakdown of the funds we have available. So for the treatment court grant program from the legislature, we have a little over $16 million available for the next biennium for 25 to 27. And this is broken down from two main sets of funds. So the other funds are general funds. That's the majority of it. That's a little over $15.5 million. But I did want to pull out the lottery funds and explain why that's important. So we have a little over $628,000 coming from lottery funds. And this is notable because lottery funds must go to a Veterans Treatment Court program. So either it will be one of the veteran treatment courts that have applied, or it can be a mental health court or another type of court that has a Veterans Treatment Court track. But those lottery funds are specific for Veterans Treatment Courts. All right. Then let's get into a little more of the breakdown. So for those of you all who are with us for the 23-25 biennium, last biennium, we had to make reductions of over $9.5 million. So you'll see here the cumulative reductions that we're making or recommending are a little under $4 million. So as I mentioned prior, we had a little over $16.1 million available. Those requests from the 59 applicants came in at over $19.5 million. Now, you will notice, though, that we are recommending funding of a little less than that 16.1. We're recommending, or the GRC is recommending, funding of a little over 15.6 million. And what that would do is it would allow us, first and foremost, to pay that treasury fee of $264. And then it would allow us to hold a remainder. And what the recommendation from the GRC and from staff as well is to hold that remainder as a supplemental round. So this would allow courts down the road into the biennium to be able to apply for additional funds later and kind of give them the ability to kind of figure out where their budgets are finishing off this 23-25 biennium and then going into that 25-27 biennium as well. Now, one thing that I think it's important to note and important for you all to have in your minds as we're going forward in this presentation is the project period for the treatment court grant goes through December 31st of this year. So while courts are able to, after your approval, of course, start using the 25-27 funds starting July 1st, they also have access to their remaining 23-25 funds through the end of this year, which again is kind of part of why we're recommending holding that remainder for that supplemental round. However, we will get into that a little bit deeper going forward. I just want to take a break for just a moment to see if I have any questions so far from the commission.
Any
Perfect.
questions? Well, I've got a quick question. So
Sure.
with the 25-27 allocation, will those funds be available through June 30th of 27 or December 31st as you did with the 23-25 allocation?
It's a little bit in the middle. So they are available through August 31st of 27. So it's a 26-month project period.
Okay, thank you.
Yeah. All right. If you all come up with questions as we go, definitely feel free to stop me. All right. What I did want to start with, though, before we get into kind of the methodologies that staff and then later the GRC used, is just wanted to take a moment to sort of echo what has been talked about in public comment so far, into that to say treatment courts are doing really incredible work across the state. And this is really just kind of taking a moment to appreciate the work that all these teams are doing in the face of a lot of obstacles. So what I have here for you is has been pulled from our friends at OJD. They pulled this looking at the trends of kind of what has been happening in treatment courts starting in January of 2020 all the way through June 30th of this year. Now, you'll notice they were doing pretty well right in 2020, and then we had this little thing called the pandemic that happened. And treatment courts, like many programs throughout the state, really took a hit. People were having a hard time getting into treatment courts. They couldn't meet. There were a lot of changes, and that really continued all the way into kind of their lowest point in 2022. But since then, thanks in part to, again, just shout out to all the work of these treatment courts, they've really been getting people back. It's coming back. And so you can see at the end of this that we're right at almost up to the 2020 levels. And so I just threw this in here to really point out that as we go, our funding has more or less stayed the same. But there are more treatment courts coming up throughout Oregon. We're seeing more applicants. And so this grant is competitive. And so we really had to be very structured in our methodologies. We had to keep them universal across the board for all the applicants to really make sure that we are being as fair and as equitable as possible to these programs, because they're all serving so many people and doing really awesome things across the state.
And Adeline,
Commissioner Freeman.
We've got a question from Commissioner Freeman.
Thank you, and I apologize about interrupting. You mentioned the COVID thing that occurred during the period of this graft, but I think you could also overlay the start of implementation of Measure 110. That had a pretty dramatic effect on those people being held accountable. That also happened in this time period.
Thank you. All right, so with that, knowing that we are seeing an increased number of treatment courts, we're seeing an increased number of participants those numbers coming back up. Let's kind of go what the treatment court program looks like, and then also, or grant program, looks like, and then also we'll kind of talk about the methodologies that we use as staff and then recommended to the GRC as well. So first, I just wanted to take a minute to just outline way for this grant process works. So the two-part application, the preliminary application. So the first part, this is going to include narrative questions as well as your required documentation. So think, letters of support from the LPSC, letter of support from your presiding judge, those kinds of things. Then together with our partners at OJD, we pulled data from the Specialty Court Management System and from the Specialty Court Operating Profile, the SCOP, so that we had really, we wanted data. We wanted to be as objective as possible using that data piece, as well as letting the courts tell us about themselves in that narrative piece. So we wanted to make sure that we were getting as round of a picture as we could of what is going on in each court. And we did this and we developed a scorecard so that after we presented the scorecards and the narratives to the GRC, they met the first time after these preliminary applications. They provided feedback based on that information, and then we provided that feedback to the applicants with the GRC's recommendation, as well as that scorecard. So they got all of that information, and then used that for part two, for that final application. So this had a shorter narrative section that was really available for them to respond to GRC feedback, especially GRC feedback that didn't necessarily require funding. So one that was really common was to stand up a policy committee courts don't really need funding to do that overall for the most part. So they would say, hey, you know, we're taking this feedback from the GRC. Here's how we're working on it. They put it in that narrative section. And then they have a budget projection sheet. Now, the budget projection sheet is going to be where they told us what money they were asking for and what they were going to do with those funds and how they were going to use it. And then they had in the opportunity that's as well to say, hey, this is how we're asking for this because the GRC recommended it. So there were multiple opportunities to respond to GRC feedback. And then when the GRC looked at those final applications, they were really looking for a couple kind of priorities, things that they really wanted to focus on. And first and foremost, of course, is the needs and improvements for adhering to the Oregon Specialty Court standards. Now, this came up in the GRC meeting, and I think it's worth noting, just because there might be differing levels of understanding around treatment courts. There are national specialty court standards as well, and then there's Oregon specialty court standards. Now, those Oregon standards are based on the national standards, but ultimately we're going by the Oregon specialty court standards. And we also asked the GRC to really look for where are resource gaps that are preventing courts from operationalizing, that's a hard word to say, these standards. So essentially, this grant was originally created to fill gaps in services. So trying to kind of remain true to that and saying, how can we help fill these gaps that other funding isn't doing that? And then also, again, we had them consider the scorecards. They considered Q1 through Q7 spending. They were also given the participation rates of each course and the completion rates of each course. And again, we want to be really considerate that there is a limited budget. So we only had a very set amount of money. And again, more applicants than ever before. So again, just really focusing on that need to be intentional about how these funds can best be utilized to support the courts in doing the important work that they're doing. And then, of course, making sure that these final budget requests align with that feedback that they received after the preliminary application. Now, the courts or the applicants themselves were given a couple of request parameters that I think it's important that we keep in mind as we go through and we look at the award recommendations. First and foremost, the request capped at a 5% increase of their original award. So what that means is that if they were awarded funds through the General Treatment Court Grant in 23-25, they could ask up to 5% over that amount. And that was their initial cap, which we'll get to in a minute. We also, thanks to 5204, which changed funding for court coordinators from the CJC used to cover that. Now OJD is taking care of that. So with that, we said, okay, no more OJD personnel requests. If you're going to ask for OJD personnel, you're asked OJD. We're going to help cover personnel outside of OJD. Also wanted on active treatment court participants. We love alumni groups. They do incredible work across the state. But unfortunately, because this funding is so limited, we really wanted to focus on active participants. So we didn't accept any requests for alumni services. Also, we did a cap on training and travel. Now, this is important to know that in the recommendation, we said there's a good chance we're going to cap it at $12,000, but if you can justify it beyond that, we will consider it. That is what we did. So while most courts were capped at that $12,000 for all of training and travel, we did have a few courts who justified it beyond that and were recommended being awarded beyond that. And then finally, this is a really big one. We did note that underspending would be considered. We, to do this, reviewed spending data from Q1 to Q7. Now, I do think, again, it's really important to note that because of that House Bill 5204 and the change in funding for coordinators, the CJC got funds back in Q3, and those funds were distributed to the courts at the end of Q3. So several courts did have an influx of funding starting in Q4. This has changed the ability for courts to spend. Essentially, some courts had more money than they could spend and were low on spending. So we wanted to figure out the best way to consider that when we're looking at programs needing a very limited amount of money. So this is how we came up. This was our methodology that we came up with to consider all those things. So first and foremost, we started with their total ask. This is the total amount that the applicant requested for the biennium. Then we looked at that initial cap that I mentioned. So for courts that had applied for funds in 23-25 and had been awarded funds in 23-25, we capped them at 105% of that. Now, I really want to point out that there were a couple courts that were implementation courts in 23-25, and then we had a couple brand spanking new, had never applied for CJC funds before courts. Those ones did not have the initial cap because we either didn't have their spending record or, again, didn't think it was fair to hold them to that implementation funding amount. Everyone else, though, had this initial cap. Then we created a scaled cap that was based on the applicant's 23-25 Q1 to Q7 spending. Now, I will show you what this looks like in the next slide, but we're very focused on how much have they spent between Q1 and Q7. Then, after we did that, we went through each and every single application line by line, and we looked at additional line item reductions. So I'll show you these as well. Really what we're looking for, though, is we're looking for unallowables. We're looking, does this make sense? Did they explain what they're asking for and how they're going to use the money? We went through each application looking for these. And then finally, we got the total recommended staff recommended funding, which was brought to the GRC. Then the grant review committee made their own recommendations, and their final recommendation is what I will bring to you here in a little bit. Now, as promised, I do want to show you what that scaled cap breakdown looked like, right? So on the left, you'll see that percentage of how much was spent in 23-25. If the court had spent from 70% or more of their total funding by the end of Q7, their scaled cap was 100% of their initial cap. If they had spent between 50% and 69.99999, then they were brought to 90% of their scaled cap. If they spent between 30 and 49.9999%, then they were brought to 85% of their initial cap. And if they had spent 29.999% or less, then they would have been scaled down to 80. None of the courts, fortunately, fell in that category, so that wasn't an issue. Now, again, I just want to throw out there, if you're looking at my numbers and you're saying, Adeline, this number of courts per group does not add up to 59, you are correct. That is because there were 11 new and implementation courts that were not included in this list who didn't have a cap. Now,
Adeline, I've got a quick question. If you can go back to that
please.
slide.
You got it.
So, for example, the 11 courts that only spent between 30 and 50% of their award by the 7th quarter, is the expectation then that they would spend the remaining, say 50 to 70% in the remaining quarter plus the 6 months extension to 12/31? Because it seems like that's a lot of money for them to be spending down in a short period of time, given their spending patterns.
Yeah, they do have, again, through that December 31st date to spend funds, but after that, the funds have to be returned. Funds don't carry on, they're not carried over, it doesn't continue on after that point. They, assuming that you all make the recommendation to a 25-27 funds, switch over to those.
Okay, thank you. And it looks like we have a question from Commissioner McPherson and then Commissioner Freeman. And Adeline, it looks like you might have froze up.
I can still see you and hear you.
Okay, great. Go ahead, Commissioner McPherson.
Thank you, Chair. I appreciate it. Adeline, my question for you is for these 33 courts that were 69 69.99% spent in through quarter 7 and below. Was that taken into consideration in the 2025-27 awards? Courts that were in those 2 lower percentiles in usage and spend rates.
I want to make sure that I think I'm going to turn my camera off because I'm having some struggles. I'm so sorry. Do you mind repeating that?
I don't mind. It was not a well-worded question. This chart and the fact that 33 courts, the percentage spent in 2023, 2025 through quarter 7 was 69.99% or lower. Was that considered by the grant review committee in deciding the recommendation for awards for 25, 27?
Got you. Yes, they did consider the scaled caps as well.
Thank you.
Commissioner Freeman.
So thank you. And I know this is about all the courts, not just the drug courts, but is there any correlation between the unspent dollars and the the courts that are having trouble spending the dollars and their deflection programs? In other words, are they having more people use deflection and less people use drug court? Or is it too early to see any correlation there? I know deflection is new. I just wonder if there's any connection there.
I definitely am not qualified to answer that question. What I will say, and this wasn't straight across, it wasn't perfect by any means, but what I will say is that there was a pretty good correlation between courts that scored well on their scorecard and the courts that were spending their money. So overall, the higher scoring courts, and again, I want to be very, very clear, this is not perfect. This is not every single one, but overall, it was a pretty similar trajectory. If they were spending their money, they typically overall had a little bit better scores. That being said, I definitely cannot speak to deflection. That I don't know if there's another person from the CJC who wants to jump in and answer that, but I cannot say.
All right, well, why don't you go ahead and continue, and if someone else wants to opine, they can jump in.
Perfect. All right. So this was the last piece, like I said, of that funding methodology was that line item review. So again, I'll try and get through this pretty quick. As we discussed, the training and travel was reduced to $12,000 unless it was otherwise justified. This didn't happen often, but absent an explanation, attorney time was assumed at 0.125 FTE. Costs for overall organizational costs that were not tied directly to program operations were cut. So this one was pretty common. Honestly, this happened quite a bit. Basically, we wanted a clear explanation of how these costs were connected to program operations. So for example, we did not recommend funding laptops for people from agencies outside of treatment courts, paying for OJD cell phones, those kinds of things. Also, line items that didn't explain their request were cut by 20%. So if the request didn't describe what was needed or why, then we recommended reducing that by 20%. And then finally, this isn't anything new. The max administrative costs were at 10% of the total ask. That was the maximum that we could provide for administrative costs. And then unallowables per the grant administration guide were removed. Now, one more piece of this before we get to the actual funding recommendations, I promise they're here, is a little chat about the prioritization sheet because this was new. So as I said, we had budget projection sheets as part of the final application. And each budget projection sheet had 2 tabs. They had expenses, and then they had the second tab, which was the budget projection sheet. Now, what this did, or I'm sorry, prioritization sheet. So what this did is it provided a breakdown of the 3 top items that the applicants wanted to prioritize the very most. So it had a section that said, if you're having to make reductions, these are the ones that we would prefer you not cut. And then in the bottom, which is, I'm trying to show you here, but recognize it's really hard to see on a slide. This provided 3 scenarios where they're saying, okay, if we have to get reductions, here's where we'd like to see the reductions made. And we did it by scenario A, which was by 10%, scenario B, which provided 15%, and scenario C, which is provided by 20%. And the idea behind this was acknowledging that the applicants know their courts the best, they know their area that they live in the best, they know their needs the best, so really allowing them to choose what reductions would be made if needed. Now, I do want to be really clear. This was stated in the final application webinar. It's written in the instructions, and I'll say it here. We couldn't guarantee that we would or wouldn't fund any of these specific requests. There were occasions where we couldn't do it, occasions where they said, you know, we want to prioritize this up here in our top 3, but we also are recommending it be reduced in scenario B or scenario C. So we tried to follow this as much as possible, but it wasn't 100% of the time. We just really wanted to acknowledge that the courts really could tell us what they needed the most and give them a little more agency over that. So with that, I do want to take a break and just see if anyone has any questions about the staff or GRC's methodologies thus far.
Questions from commissioners?
All right, let's keep rolling then. So we'll get into the request. So I just think this is a handy little map, courtesy of one of my colleagues, that really showcases the requests by county. So you see the darker the blue, the more funding that was requested, all the way to that gray. Those counties did not receive treatment court funds. Okay. So here's the request, and then here was the allotment. So kind of a showcase of what that looks like across the state. We're going to get recommendations of funding. So I do want to note that these next 5 slides are done by court type. So the one that you see on your screen now are for adult treatment courts, and then we'll continue by court type as we go. Now I'm going to do something that I'm not very good at, and that is stop talking. So you all let me know either A, if you have questions, and B, if you're ready to stop looking at the slide, and we'll move on.
Adeline, are we going to vote on these by treatment court type, or are they going to all be bundled together?
So our recommended motion language, that is totally up to you. Our recommended motion language was actually by county, and then it allowed for each, if there was a commissioner who needed to step away because they're a member of that county, it made it easy to do so. But you all can do whatever you think is best.
Okay, any discussion on adult treatment court funding recommendations? Commissioner Freeman.
Thank you, Mr. Chair. So I want to make sure I understand this, and thank you for the great explanation. So the way the committee broke this out is sort of, there was one big pot of money, and then they did all the work you just described. So each of the different court types are allocated their money based upon the total amount. So if I know we can't change each one, we can only send back to the committee to do something different, but they all affect each other. So if we approve, the drug treatment court portion, and then decide not to approve something else, it doesn't really work that way, right? I mean, it all has to be one big formula.
It is all coming out of the same pot. What I will remind you is there is a little over 500,000 sitting currently as a supplemental fund.
All right. Thank you.
I've got a question for you, Adeline. So you talked about the instructions of the 105% cap, no OJD personnel. So one of the things that I'm not clear about when I look at the request versus what was allotted is how many of these counties, for whatever reason, didn't adhere to the instructions and actually asked for more than was allowable because of the 105% cap or the OJD personnel or alumni or any of the other things that you mentioned.
We did have a couple that went over. We just automatically reduced them to their initial cap. That's where we started at, to that 105%. I don't have them. If you wanted that information, we could get it to you. I don't have it listed out because that was part of our immediate process, is to bring it down first to that initial cap and then continue on through the breakdown that I described earlier.
Okay. All right. So at this point, are we preparing for a vote on the treatment courts first by county?
My suggestion would be that we first hear this question from Commissioner Beach, and then after that, I would suggest going through all the types of treatment courts, and then deciding what you want to do from there would be my suggestion.
Great. Go ahead, Commissioner Beach.
Thank you, Chair. Twofold question for you. You just mentioned around, I believe, and forgive me, I didn't hear it perfectly, but there is around 500,000 remaining in supplemental funds. Is that correct? And if it's correct, is it for all the treatment courts or just adult treatment court?
So that's correct. We have a little over 588,000 set aside currently per the GRC recommendation as a supplemental round. And that is for all of the court types. So that is one big pot.
And just a follow-up question, does the CJC yet know what the time period of when that supplemental grant portion may be offered? Is that typically mid-biennium?
Mm-hmm.
Typically, yeah. Typically, it would be somewhere, I don't want to give you too big of a range, but somewhere between Q4 and Q6 is typically where that would shake out. But that hasn't been decided. And you all, and maybe I should double check with the CJC, but my understanding is you all could make a recommendation to that timing if you felt it necessary.
And then one last follow-up, forgive me, Chair. So with regard to that slide that you showed for counties that were so underspent, has the CJC ever suggested, or, I mean, obviously I know you provide technical support, reaching out to those counties to see, how they can spend those funds. But has the CJC ever considered allowing those funds that counties know will not be spent be included in that supplemental round?
I am going to, in full disclosure, I am not super comfortable in speaking to what we can and can't do after that project period deadline. I would ask my colleagues, someone with a lot more knowledge than I, to come and speak to that. One thing I will say that I think is important to know is that courts were given the opportunity, if they knew that they were significantly underspent, they were given the opportunity to decline either part or all of their final disbursement. And so that was based on where they felt their spending was. It wasn't required by any means. But if they did, right, if they didn't get that part or all of that final disbursement, then it made it look like their spending was better, right? Because they didn't take that money ultimately. 13 courts did take advantage of that, of the 50, I guess 56 that are currently in the 23-25 biennium. So that was an option that was made available to them. Beyond that, though, I will ask my colleagues at the CJC if they can speak to if we can continue it on after. My understanding was no, but I don't know enough.
And forgive me for putting you on the spot.
No, that's, I think, my job. So.
Great. And looks like we have a question from Rep. Lewis. And then I just want to be mindful of time. We're already quite a bit over. So hopefully we can, after this next question, move on. Go ahead, Representative Lewis.
Thank you, Chair. So I'm looking at Clackamas County. Do you have any additional information on why the reduction is so significant for that particular county over what was
Yeah.
requested as compared to the others? Thank you.
Yeah, specifically for Clackamas. So their spending was at 47%. So they had a scaled cap of $788,359.53 to start with. And then all of their housing was reduced by 20% due to a lack of information or breakdown of how they were going to use funds.
Okay, thank you.
All right, let's keep moving with the other treatment courts. Or the other
Sure.
specialty courts.
So here's our and again, I will look to all of you to tell me when to keep moving.
Okay. Unless there are any questions. Yep.
These are our family treatment courts.
Mm-hmm. Any questions?
These are our juvenile drug treatment courts.
Great.
These are our veterans treatment courts.
And these are largely funded by the lottery funds, right?
Yeah, predominantly.
Great.
And then finally, our DUI courts.
Okay, I've got a question about the disc court. So, I read the letters that were submitted by multiple folks, and it sounded like Multnomah County's application that they may have erred in the submission by not putting in requisite information. And I'm just curious kind of if there's any precedent for resubmissions of applications. And I know at this point, you know, we'd have to rejigger everything if we were to change the amount of one court. But I'm curious if anybody can speak to kind of process and precedents.
So to my knowledge, that is typically not done. Typically, one thing that I think might be helpful to remember is that first off, I would like to clarify something that was in one of those letters. One of those letters that said that they were completely reduced to zero for all treatment services. That's not true. They have a little over 126,000 still going into contractual services, so that they are getting some funding there in contractual services. However, what I will say is, again, I just want to remind everyone that there is that like pretty sizable supplemental chunk that is there. That I think one thing that might be a little bit more helpful potentially, and again, it is your call as the commission, but I'm wondering if between having funds left that they can finish through December of 31st of this year, and then starting on their new funds for 25 to 27, if we had that supplemental round, if that wouldn't be kind of a more effective way for them to then have really a good idea of what they need for their funding, as well as giving them the opportunity to kind of rewrite and provide that information that we didn't have before.
Great, that's helpful. Any other questions from commissioners? Commissioner McPherson.
Thank you, Chair. Along the same lines, the question I have is that the supplemental funds, it's not required to hold back supplemental funds, correct? So we don't have to hold back 588,000. And we know from 23-25 that like 2/3 of the courts did not reach even 69.99% of this allocated spending allotment through Q7. So, I mean, I obviously will have to abstain from the vote, and I have more to say, but I'll wait till the appropriate time. But I am very supportive of allowing Multnomah County to resubmit for a whole host of reasons, particularly given that there is a sizable amount that's being held back, and given that the history from 23-25 shows us that 2/3 of the courts didn't use the entirety of their funding. And it's really hard for courts and providers to budget when the money's not there. So to say we can wait 4 or 5 more months and see where we're at puts the providers and the courts in a really bad position. And I have more to say when the time is right. Thank you, Chair.
Mhm.
I do, if I may, I do want to just note that we and the GRC followed the same methodology for all the courts. So Multnomah Well-Leg Disc Court is a good example of one that it's a significant decrease. We did follow the same methodology. So similarly, there were positions that were cut for being duplicative in other courts. There were positions that were, or line items, excuse me, that were reduced pretty significantly by that 20% because they didn't provide enough information. So I just want to note that anything that is done in sense of like giving them the chance to reallocate, I think just being consistent in what we provide as access for all the courts. They definitely were not the only people or only courts, excuse me, who experienced reductions based on this methodology. We carried it across all court types and all courts.
Mhm. Okay, great. Any other comments, discussion? All right, let's move forward.
All right, so this we can get through quick. This is just to showcase what the counties have decided to allot to OJD. So again, it's all coming out of the same pot. It's all county money. They just allot it to OJD to be used using their spots cards. It goes a lot quicker for them to purchase supplies, and then also in training and travel. So in those two categories, supplies and training and travel, they several counties have requested their funds be allocated to OJD in the numbers that you see here. And then finally, this is just a quick reminder of the total funding. So again, there was about 19.5 million requested of that 16.1 that was available. It is recommended by the GRC to reduce that by about 4 million, making it so that a little over 15.5 go out now that are awarded now. That's right around that 80% fulfilled, and then holding on to that remaining funds for doing the supplemental rounds later on and helping those courts who might need additional funding. And then I do have some potential motion language, but you let me know when you're ready for it.
Yeah, let's go ahead. Great. I think this addresses the abstentions for commissioners from various counties. If there's no further discussion, I would entertain a motion.
Mr. Chair, I believe I can do the first one if it's appropriate.
Okay, and did you have a comment here, Commissioner McPherson, before we move forward?
Yes, I do. And I know we're behind time, but I do have a comment if I could.
Yeah, please.
So I find the support letters from Multnomah County, particularly the Multnomah County courts, persuasive. I know I have to abstain, but I am supportive of their ability to have reconsideration for the reasons stated in that letter. I want to put on the record that we know, and we all know this, that in Oregon, we tend to be in the bottom 5 of all states in the United States when you consider the need for mental health and substance abuse services and what we have available to people. The Multnomah County treatment courts have been established for a significant period of time, and they're all prison diversion courts. So we have a state where when you compare us to other states, and I know that you lose things in comparison, so I'm skeptical of doing so, but there are other states that have pre-charging diversion programs once you've been charged. They allow people to earn a dismissal of their case. We just don't have those available in Oregon. It's very limited to DUI, first-time offenders, and some DV cases. So these treatment courts serve a critical function to our communities and to the system here. And to have 3 diversion courts taking hits to the amount that are apparent through these slides and information, and based on the letter from the Multnomah County treatment courts, they're going to have a significant impact. And yes, Multnomah County is the largest county. It has a large population base, and we have a significant population here with mental health and substance use disorder. And I'm very concerned about where we are at from the Grant Review Committee for these treatment courts in Multnomah County. And so I'm supportive of reconsideration, particularly when you look at the stats that 2/3 of the courts were underutilizing the funds in 23-25, and you don't have to hold back supplemental funds, which is really difficult for the providers to have to wait and resubmit for a supplemental round. You have one county that seems to me to be very persuasive as to why reconsideration should occur. I'm very supportive. However, I'd have to abstain. Thank you for letting me the opportunity to speak.
Commissioner Norton.
Yes, thank you. I think my concern is, as somebody who's sat on these grant review committees, I know the amount of work and the angst that goes into making cutbacks and making adjustments and being equitable, and also being threatened by large counties, that I feel like we would have to have a very, very compelling reason to go against the grant review committee when they're the ones that have looked all of them. They're the ones that have done all the formulaic work. I know how much I sit on the JRP, Justice Reinvestment Program. I always call it JRI. I sit on the committee and I know the angst that we go through. And so for that reason, I would be unlikely to go against the grant review committee's recommendation at this point.
Commissioner Harris.
Yes, I concur with Commissioner Norton. I've been a part of grant recipients where process was not followed, not from CJC, but from other entities. And it's catastrophic to the system to have one-offs and exceptions made in a process that's intended to be consistent and applied consistently across all applicants. So I think it would be a mistake to deviate from that for this purpose.
Any other comments? Okay, well, I feel like it sounds like the will of the commission is to follow the grant review committee's recommendation. I would say that one other option could be that we approve all of the applications except for the DISP courts, allow them to reconsider, given that they failed to put in information that they felt was necessary, have that re-reviewed and brought back before the commission, and a determination could be made to either fund it as at the original recommendation or use some level of discretionary funding. But I would want to hear a majority of folks willing to do that if we were to entertain such a motion.
Commissioner Solomon, if I may.
Yeah.
I just want to acknowledge that since the GRC and several county or courts watched the GRC meeting. And again, I just want to stress that we use this methodology across all courts. So there were several courts that reached out to the CJC to say, oh, hey, I meant to put in this information, or hey, I meant to put in that information. Well, I do want to acknowledge that DISP definitely had the most reductions due to that. There were definitely other courts that had the same experience.
Got it. Well, that's also really helpful information. All right. At this point, I also want to be mindful of the comments in the chat. DISP treatment courts support reduced to 0, not by 20%. Can and Director Keck, go ahead.
Afternoon, everybody. Chair Solomon, I just wanted to point out two things. One, as it relates to the chat, if you would like to enter that into the record, if you would read it in full, who it's from and what is stated. And then I had a comment around the supplemental funding hearing this discussion, but I'll let you deal with comment first.
Great. So let me read that into the record from Cecilia Howes. I believe the funds approved that are being discussed are for VigilNet monitoring, but not treatment services. And then she goes on to further say, DIF's treatment court reduced to 0, not by 20%. And Adeline, I don't know if you have any response to those comments.
I'm pulling up I don't have their application in front of me. So I'm pulling it up as we speak. Typically, we don't go into them line item by line item. But the second part of that is correct for DISP in particular. Let me, if I may, pull back to that. For their intake, pre-engagement, and court participation, they were completely cut because it was unclear what position this was funding and how these roles differed from the court coordinator. The information that was provided in the application didn't make that clear. So that second part is correct. They were fully cut, not just reduced by 20%.
Okay.
But let me pull up the other part if you want me to.
Sure. While you're looking for
Or
that,
maybe, yeah.
Director Keck, do you want to go ahead and give your thoughts about the supplemental funds?
I just wanted to acknowledge that as the motion language is currently kind of put together, there is, as mentioned, funds left for consideration. You all do have the discretion, of course, to direct staff as to what to do with that. I might suggest that be something that entertains other needs or specific needs, available to all, not to one, but you do have that ability separate and apart from these decisions. So even that were to be something you ask for staff to develop in preparation for, say, a future meeting, that would be a way to handle the remaining funds.
Great. That's helpful. All right. Any other, and I see we have another comment in the chat from Mariel Mata. I'm not sure if it's appropriate time for comment from the DA's office in Multnomah County, but I would like to add something if possible. What's our, I mean, generally speaking, we don't allow additional comment outside of public comment. And we're running a little behind on time. So I'm inclined at this point for us to move forward. Commissioner Norton.
That was just going to ask, is there a motion on the floor? Because I thought we had a motion on the floor.
I don't believe we do. We have motion language.
I was trying.
Yeah, and I think Commissioner Freeman was about to.
Okay. Commissioner Freeman, if you'd like to, otherwise I will.
Yeah.
I'm happy to have you do it, and I'll second it. Go ahead.
Okay. I would move to approve the recommended treatment court grant program funding as presented on the 2025-2027 treatment court grant funding tables for all counties with the exception of the courts in Douglas Lane, Multnomah, and Yamhill counties.
I'd be happy to second that.
All right, we have a motion made by, hold on, Commissioner McPherson, do you have a comment or amendment?
Yes, I'm asking you to include Washington. I have to abstain from Washington County as well, not just Multnomah. Thank you.
The motion maker's okay with that?
Okay, okay, great. We have a motion made by Commissioner Norton, second by Commissioner Freeman. Would you please take roll, Jenny?
Yes, Commissioner Beach,
Yes.
Commissioner Freeman,
Yes.
Commissioner Harris,
Yes.
Commissioner McPherson. Oh, sorry, you're abstaining, correct?
No, the abstentions will come later when we do the individual counties.
Sorry.
These are for the counties outside of those.
Okay.
Yes.
Commissioner Norton,
Yes.
Commissioner Perosa,
Yes.
Commissioner Solomon.
Yes.
Looks like we pass unanimously.
All right, is someone willing to make a motion to approve the treatment court funding for 25-27 for Douglas County?
So moved.
Who is
Commissioner
that?
Beach.
Commissioner Beach. All right, Commissioner Harris?
I'll second.
All right, we have a motion made by Commissioner Beach, seconded by Commissioner Harris. Roll call, please.
Commissioner Beach,
Yes.
Commissioner Freeman,
Abstain?
Commissioner Harris,
Yes.
Commissioner McPherson,
Yes.
Commissioner Norton,
Yes.
Commissioner Perosa,
Yes.
Chair Solomon,
Yes.
and looks like passes unanimously.
Right, is someone willing to make the motion for Lane County?
So I'll move.
All right, is there a second? And actually, do you want us to read the full motion into the record? Staff?
No, sir, that wouldn't be necessary.
Okay, great. All right, we have a motion made by Commissioner Harris. Commissioner Freeman, are you wanting to make a second?
Second that, yes.
All right, motion made by Commissioner Harris, seconded by Commissioner Freeman. Roll call, please, Jenny?
Commissioner Beach,
Yes.
Commissioner Freeman,
Yes.
Commissioner Harris,
Yes.
Commissioner McPherson,
Yes.
Commissioner Norton,
Yes.
Commissioner Perosa,
I abstain.
and Chair Solomon,
I abstain.
and passes unanimously.
All right, next up is Multnomah County. Someone want to make a motion?
I would so move. And I'd be
Okay.
happy to read it if that's easier, Chair.
I think we're fine. Is there a second?
I'll second Commissioner Beach.
Great. Motion made by Commissioner Perosa, seconded by Commissioner Beach. Roll call, please.
Commissioner Beach,
Yes.
Commissioner Freeman,
Yes.
Commissioner Harris,
Yes.
Commissioner McPherson,
Abstain.
Commissioner Norton,
Yes.
Commissioner Perosa,
Yes.
and Chair Solomon.
Yes.
Passes unanimously.
Okay, finally, Yamhill County.
Commissioner
someone-
Norton moves to approve Yamhill County as recommended on the slide.
Great. Is there a second?
I'll second.
I'll second.
All right, I think Commissioner Perosa beat you to the punch there. Motion made by Commissioner Norton, seconded by Commissioner Perosa. Roll call, please.
Commissioner Beach,
I abstain.
Commissioner Freeman,
Yes.
Commissioner Harris,
Yes.
Commissioner McPherson,
Yes.
Commissioner Norton,
Yes.
Commissioner Perosa,
Yes.
and Chair Solomon.
Yes.
It looks like it passes unanimously.
All right. Anything else on the treatment courts?
Just a friendly reminder, my apologies on the slide, but you also need to do Washington County.
Oh, right. All right. Is there someone willing to make a motion for treatment court grant program funding for Washington County?
This is Freeman. I'm willing to make that motion.
Great. Is there a second?
Commissioner Norton was that second.
All right. Motion made by Commissioner Freeman, seconded by Commissioner Norton. Roll call, please.
Commissioner Beach,
Yes.
Commissioner Freeman,
Yes.
Commissioner Harris,
Yes.
Commissioner McPherson,
Abstain.
Commissioner Norton,
Yes.
Commissioner Perosa,
Yes.
and Chair Solomon.
Yes.
Passes unanimously.
Okay, finally, per your comments, Director Keck, I would like us to add on a future agenda the process and timing by which we decide how to use the supplemental funds in hopefully the near future, so we can provide some clarity to folks.
Yes, sir. We'll add it to the agenda. Is there any other particulars you would like prepared for that conversation?
I'll noodle on that at the moment. I don't. Commissioner Norton?
Personally, I'd like to hear from the grant review committee on what their recommendation is for those, if it's different from what's being recommended here.
Great. All right. Moving right along, and we've got quite a bit of ground to cover in the last 40 minutes. Apologies, but this was an important conversation. So next up is the JMOOD temporary rules, and I think Rachel is going to walk us through that.
I am. If you give me just 1 second to pull up my presentation here. Okay, can you all see that?
Yep.
Okay. So good afternoon, y'all. I'm Rachel MacArthur. I'm staff here at CJC. And today I have a few programmatic changes for both the JMOOD grant program and the Organized Retail Theft grant program. Tara Solomon, I think I am like maybe the next 3 or 4 things on the agenda. If you're good, I can just kind of go through and ask for the vote or feedback when applicable, and then continue if that's okay.
Right.
Rather than
Yep.
taking a break.
Yeah.
Okay, so let's just move along. So this is just an update on the current JMOOD program. HB 4002 established this in 2024. Currently, we have a little over 10,125,000 in available funds. That is up slightly from our last grant cycle. So this is what is available going forward. And eligible recipients include cities and counties, as well as federally recognized tribes, both of which operate a local correctional facility. Applicants have the opportunity to apply as a group or apply individually, and the statute really is pretty narrow in terms of what these funds are for, and they are reflective in both the OARs and the solicitation. So this is just a quick update on that. And then we have some amended language that occurred out of this most recent legislative session. Senate Bill 236 changed the language of eligibility, the eligibility language. And so I believe you all got a draft copy of the rules with the bolded language included. And so it's essentially just expanding who is eligible for these funds. And so because of this, staff is proposing temporary rulemaking that we are able to do this. And essentially what this will do is ensure that there isn't a disruption in the distribution of funds to these facilities as we go into the new grant cycle. And for some context, the current grant cycle ends September 30th, and the idea is to get funds out by the end of this year, so there isn't any sort of disruption in services. And what this would mean is that these changes would be temporary. They would be effective immediately, and they would be in place for 180 days, and then would be followed at a later date with permanent rulemaking. So we would have the permanent rulemaking notice, and we would then have the public comment period, which would be the 7-week period, which normally occurs. And so staff recommends temporary rule changes because we're not making any substantive or directional changes to the program. It's going to be the process will be the same, relatively the same going forward, just simply acknowledging these changes in statute and then responding in kind. And so I can take any questions, but the staff recommendation is that we file for temporary rulemaking changes to update the language with this specific definition so that we can get a solicitation out as soon as possible.
Great. Any comments, discussion?
And I do have motion language on this, should you
Great.
want to see it.
Please. Yep. Right. If there's no discussion, is there someone that would be willing to approve the temporary rule changes for the 25-27 jail-based medications for opioid use disorder grant program?
Commissioner McPherson, I make that motion.
Is there a second?
I'll second
Commissioner.
Commissioner Harris.
All right. Motion made by Commissioner McPherson, seconded by Commissioner Harris. Roll call, please.
Commissioner Beach,
Yes.
Commissioner Freeman,
Yes.
Commissioner Harris,
Yes.
Commissioner McPherson,
Yes.
Commissioner Norton,
Yes.
Commissioner Perosa,
Yes.
Chair Solomon.
Yes.
Passes unanimously.
Okay.
All right. Rachel.
Yes, this does not require any vote from you all, but we do want to just pause and recognize that you all have the discretion to include any review criteria for the solicitation for this grant program. We do want to release it by the end of August with a due date of October 9th. And I believe you all were given a copy of the solicitation for your review. The biggest change is it does include the language that you all just approved for the rulemaking. And so it will expand eligible applicants with that language. But if there's any other feedback or review criteria that you all would like to provide in the solicitation, we are happy to take that feedback.
Great. Any feedback at this time?
Okay.
Okay.
So we will move forward as is. Thank you for that. So with the rule changes that you all just approved, we do also want to ask today that you all approve the funding table. If you, for those of you that were here last year, remember it is a formula grant. And so we are going to ask that you approve that today. Just a reminder, this is what is in OAR. You all do have the ability to determine a set aside for tribal correctional facilities. At this time, there are no active tribal correctional facilities. And so all of the funds, the $10,125,000 will go to the counties and the local correctional facilities. And then also, if you look at B, this is the elements that are in the formula. So it's intake rates, average daily population of a facility, overdose data, and population density for the jurisdictions served. And so this is just a reminder of your all's authority. We did update the data, so it is the most current data to be put in the formula. A reminder: there is a rural set aside. That number did not increase this year. It was the same number of counties, 16. Just a note: because the amount available increased, that set aside increased just a little bit from 62,500 to 63,281 available with that set aside. And just a reminder as well, in the OARs, it is based on the definition of rural area that you all approved last spring. So we do have jurisdictional population, booking intake rate, daily jail population rate, and then overdose data. We also, in doing this, did not change how we weighted them. This approach you all approved last time as well. You obviously have the ability to change that if you feel the need. But with the updated data, we use the same weighting for these elements as last time.
Great.
And, oh, sorry. Did you have a question?
No,
Sarah?
no,
Okay.
sounds
Okay.
good.
So this is the funding table, and I apologize, it is pretty crowded, but I wanted to make sure you all saw it at once. If you will look, there is a Clackamas TC and a Washington TC. Those are two of the transition centers that are now eligible with the expanded definition language that was approved or that you all just approved in the rules. And so they are eligible to apply, and they may do so when the solicitation is released. So I'll give you all a second to review this.
Yeah, Rachel, my recollection is we had far fewer counties in the past. Are there many new counties or jurisdictions?
Yeah, so are you talking about who applied last time versus who we think may apply this time? It's the same still available this time as last time. And so even I think Springfield is still the only, yeah, they're on here. They're still the only local city jail that's eligible. We did have some counties that didn't apply last time, and they indicated it was because of the short turnaround. If you remember, I think we had 30 days between the release of the solicitation to the application being due. We've expanded it, so they are going to have more time. So that was some feedback. So we are not sure how many people are going to apply, but we do, yeah, we do have those two more that are eligible, along with everybody else is going to have the same opportunity.
And did we have a supplemental round last time for the counties that didn't apply?
We did not, and the reason why was because the grant period went from October 1st of 24 and it ends September of this year, and so it was only a year. So there just simply wasn't enough time to do one. But this is going to be for the full 2 years, and so any leftover funds, there is an opportunity or will be an opportunity for a supplemental round.
Right.
Absolutely.
Okay, great, thanks.
So any questions on this funding table or how we came to these numbers? Okay, I have language for a motion if you're ready for that, Chair Solomon.
Please. All right. Is there someone that would be willing to make a motion to approve the staff recommended formula funding table for 25-27 jail-based medications for opioid use disorder grant program?
I'll also move.
I'll second that.
Great. We have a motion made by Commissioner Perosa, seconded by Commissioner Freeman. Roll call, please.
Commissioner Beach,
Yes.
Commissioner Freeman,
Yes.
Commissioner Harris.
Yes.
Commissioner McPherson,
Yes.
Commissioner Norton. Looks like Commissioner
I
Norton
think she had to leave.
might have gone. Yeah.
Yeah.
Commissioner Perosa
Yes.
and Chair Solomon.
Yes, and I'm assuming we still have quorum.
We do.
Okay.
And that passes unanimously.
Super.
Okay, I will just keep moving then. So we do have, very similar to the temporary rulemaking opportunity for the JMUD grant program. We also have one that has come forward for the organized retail theft grant program. And just a review, this established, it was established in 2023. There are $5 million in available funds. And originally this bill, Senate Bill 900, established it for cities and counties with law enforcement, the Oregon State Police, and then community-based organizations, all to address organized retail theft. Funds were distributed on a competitive base for both law enforcement and CBOs, and then funds were available to OSP. The last time that this grant program was run, OSP was not interested in any funds, and so none of them were set aside. And so the $5 million of available funds went to law enforcement agencies and CBOs. And out of this most recent legislative session with HB 3069, the grant program was amended. So there was some language changes that removed Oregon State Police as an eligible applicant and added the Oregon Department of Justice, and then removed community-based organizations as eligible applicants. And then so now funds are available on a competitive basis to local law enforcement, and funds are available to the Oregon Department of Justice. And so with this change in language, if you look at the draft rules that were provided, you can see some of the language being struck out where community-based organizations are present and where Oregon State Police are present, and replaced with the Oregon Department of Justice. And so for the similar reasons for the JMOOD grant program, we propose a temporary rulemaking process in this instance for the same so that we can, same reason that we can avoid disruption in the distribution of funds to the applicants for this grant program. Again, these changes would be made effective immediately. We could then release a grant solicitation. They would be in place for 180 days, and then we would go through the permanent rulemaking notice and public comment period. Very similar to the JMOOD program, we're not making any substantive or directional changes in this program. We're just simply acknowledging the changes that were made in the statute and responding in kind. And so we're just asking for the authority to do the temporary rule changes for this program as well.
And Rachel, can you tell us how it's envisioned that DOJ might use these funds, since they're not a traditional law enforcement organization that's going after retail theft?
Yeah, so I was going to bring that up with the review of the solicitation, if that's okay. So
yeah,
I do have motion language for this, and then I do have a note on DOJ and their role and how they play, what they role they play in this as well. So
well, since it informs this decision, it might be helpful just to share that up front.
yeah, so you all do have the authority here. I'll just scroll this way. And so just to kind of get this is your all's authority. You may create a set aside of funds to award to the Oregon Department of Justice. And so it's not competitive. It would be a set aside. If I may, and we can come back to this, but we do have a staff recommendation addressing that. So I can either give it now or when we actually, or will it help informing the temporary rules?
I think it might help inform the temporary rules if we know kind of the ways that you're envisioning this to be used.
So we do know that DOJ is very interested in applying. They are interested in being an applicant. They specifically are interested in equipment to assist with operations. And so we don't know yet to the extent of what that looks like in terms of what they would need for that equipment or what the detail of that is. And so staff recommendation would be to wait until the preliminary application after that due date has occurred, so that we can get a better idea of how many applicants are going to be part of this grant. And then we can make a more informed recommendation in terms of a potential set aside and what that equipment would be, things like that, where we would just have a little bit more information. But they are interested in applying.
Okay, well, that still seems a little vague to me, but given that we're not making a funding recommendation, I'm fine with moving forward.
Okay.
Unless, so let's keep
I can
going.
go back. Is this okay, this language?
No, this is great.
Okay, perfect.
All right. Is there someone willing to make a motion to approve the temporary rule changes for the Oregon Retail Theft Grant Program for 25-27? Don't
I'll move.
everybody
This is
jump at
Commissioner
once.
Harris.
Great. Is there a second?
I'll second Commissioner Beach.
All right, motion made by Commissioner Harris, seconded by Commissioner Beach. Roll call, please, Jenny.
Commissioner Beach,
Yes.
Commissioner Freeman,
Yes.
Commissioner Harris,
Yes.
Commissioner McPherson,
Yes.
Commissioner Perosa,
Yes.
and Chair Solomon.
Yes,
Passes unanimously.
great.
Okay, and then just last, this is a solicitation. It will be released in late August. The preliminary application will be due September 21st. Like I said, at that point, I think we'll have a little bit better assessment on how many applicants are applying and to the extent that DOJ is in need of funds from this grant program. With all of that, you all do have the discretion to include additional criteria for evaluating the grant programs. If you remember with this grant program, it does not have a GRC. And so the evaluation of applications does come to you all. And so if there is, you all, I also have a copy of the solicitation. If you have any other evaluation criteria that you would like to add, we'd like to hear it.
Okay. Any comments at this moment? All right, hearing none,
Okay.
We can move forward.
All right, thank you. That is all that I have. So thank you.
Great, and miraculously, we're caught up on time. Thank you, Rachel, for helping us move through all those action items so quickly. Next up is agency updates. Director Keck?
So Paul Ryan had to leave for a meeting, so it's
Oh,
going to
right.
be Kelly Officer.
Okay, great. Kelly,
Yes, hi, Chair Solomon and Commissioners. Yes, Ryan cannot be in two places at once.
right.
And so I will do my best to fill in for staff. But actually, I do believe we do have one more item on the agenda.
Oh, is that the Klamath Falls?
The Klamath Falls for the organized retail theft,
Yep,
and I
yep.
believe Shelby is
Yep,
ready for that
yep,
one. Thank
you're
you,
right.
Shelby.
My apologies.
Yes.
Thank you.
Yes, thank you, Kelly, for that. Just a moment while I upload my presentation. Okay, so thank you, Chair Solomon and Commissioners, and good afternoon. For the record, my name is Shelby Grauer, and I'm the grant coordinator for the Organized Retail Theft Grant Program. I'm here today to provide an update on the grant adjustment for Klamath Falls Police Department that you heard in June. As a reminder, this adjustment request is before you today because it originally requested to reallocate more than 10% of their overall award. Klamath Falls has submitted an amended budget adjustment request that reduces the overall amount that they're requesting to reallocate. It's important to note that this still meets the 10% threshold. However, I wanted to highlight that there is a reduction in the amount that they're requesting, and they've also provided some additional information. So at this time, they're now seeking to reallocate $46,261.21 to assist with purchasing and upfitting unmarked detectives vehicles. The intended upfitting includes equipping the vehicles with emergency lights, sirens, radios, and storage boxes. Within this amended adjustment request, they've clarified that the funds requested will be used to supplement their existing vehicle budget, so that will not be used to supplant any existing funds, and that this will assist with replacing existing vehicles that are nearing being unserviceable. They've identified that these vehicles will be used by major crimes detectives whose responsibilities do include investing organized retail theft. And with that, they estimate that a minimum of 50% of the identified vehicles' use will be focused on combating organized retail theft specifically. And if approved, the funds will be reallocated as shown on this screen. They will be reallocated from radio and camera equipment, supplies, and police officer personnel expenses. So Chair Solomon, I'll pause here for any questions or any discussion. I do have motion language, but I would like to pause at this time.
Great. Any discussion, questions? All right. Motion language.
Thank you.
Right, is there someone willing to make a motion to approve Klamath Falls Police Department's budget adjustment as requested?
This is Freeman. I'll make that motion.
Is there a second?
Commissioner Beach, I'll second.
All right, motion made by Commissioner Freeman, seconded by Commissioner Beach. Roll call, please, Jenny.
Commissioner Beach,
Yes.
Commissioner Freeman,
Yes.
Commissioner Harris,
Yes.
Commissioner McPherson,
No.
Commissioner Perosa,
Yes.
and Chair Solomon.
Yes.
Motion passes.
Thank you.
All right. Anything else, Shelby?
No, thank you. Have a great day.
Great. Now we are right on time for the last 15 minutes for agency updates. Go ahead, Kelly.
Yeah, thank you again, Chair Solomon, commissioners. As requested at the last commission meeting, we have an update on the behavioral health deflection grant program for you. Lots of changes with that, and a commission meeting coming up in September for the group. And so KC is ready to give you that update. She needs to leave right at 2:55. So I'm actually going to share the slides, and depending on questions, she may step out and I'll do my best to jump in, although you definitely want Casey, not me for this. So let me see if I can share these slides for you all.
All right.
Right, I'm seeing them. Good afternoon,
Welcome, Casey.
commissioners. Thank you so much for the welcome, Chair Solomon. For the record, my name is Casey Beck, and I'm the Behavioral Health Program Manager. As Kelly mentioned, I've got a hard stop today at 2:55. We're in the middle of a really amazing recruitment process for CJC staff, and I have some interviews to run. So I appreciate your flexibility, but we'll try to get through this. Next slide, please. So this particular slide should look very familiar. And if you're feeling a little bit of deja vu, it's because I presented to you last month at the commission meeting. And I just wanted to give you a quick update and move that arrow a little bit to the right to orient you to where we are in time and space as it is in regard to the phase 1 of the BHD solicitation process. So the solicitation opened on July 30th. It's currently open to all of Oregon's counties. Applications are due August 31st, and award decisions are to be made by you all at the commission meeting on September 16th. So that will be the next commission meeting. Our goal is still to send out contracts in early October so as to eliminate any gaps in funding with current programs. And in regards to phase 2, we're still in August, miraculously, and in the middle of all of the projections technical assistance work. That's that light blue bar that you're seeing on the timeline. We're holding a whole bunch of TA meetings with interested counties throughout the entire month of August. Our research team, specifically our senior researcher Will and colleague Monica, are hard at work meeting with all of the interested folks in working with these projections, and I plan to give you some more details on that process a little bit later. But those are due to the CJC on September 19th, just a few short days after that next commission meeting. And our goal is to open the phase 2 of the solicitation after the October commission meeting with the award decisions in December. Next slide, please, Kelly. All right, so in terms of phase 1 solicitation process, application and review, just had some things to orient you in terms of what to expect. As of today, as of this morning at least, when I checked our SM Apply software, 17 applications for BHD phase 1 had been started. And last year, we received a total of 28 applications with a 27 total programs because there was one regional consortium. And I am expecting somewhere around the same number in terms of total amount of applications, maybe a few more, and also may be expecting a few more regional consortia. So just something to prepare you for in terms of numbers. As I mentioned on the timeline slide, the solicitation will close August 31st, and that actually leads us right into Labor Day weekend. So staff will be downloading applications and beginning our review for that eligibility as soon as we're back on September 2nd. And all of those applications will be sent to commissioners also in advance of that September commission meeting so that you all can orient yourselves to the BHD program proposals as it relates to phase 1. And at that September 16th commission meeting, we plan to provide a high-level summary of the program proposals that you will have read, the participant eligibility requirements that folks outlined in their applications, what deflection pathways are currently being operated or planned to be in operation this biennium by these programs, and then a reminder of that phase 1 formula allocation for each county. So these are formula grants based on meeting eligibility criteria, and I wanted to flag that here for a couple of reasons. But one is to orient you to phase 1, as you may recall from the last commission meeting we had. Phase 1 really focuses on that first 25% of the remaining available funds, and it's kind of a quick process, but the goals behind this was to eliminate any gaps in funding so that programs would continue to have momentum as we enter this new biennium of work. So for phase 1, the focus is really going to be on the eligibility of these programs and their program proposals. Their budget, while it will give you kind of a snapshot of what their programs might look like, it won't exactly be a whole picture. And the reason I am saying that is because 25% of the remaining funds, that might be a smaller portion of a program's total budget. And it won't be until phase 2, when 70% of the remaining total funds is dispersed to counties with a new formula share, that counties will have an opportunity to understand what their total allocation is and then how to kind of update their budgets accordingly. So I kind of wanted to just mentally prepare you all for that at the September 16th commission meeting. When you're reviewing the budgets, it will be, a small portion. Maybe it will be, for instance, a case manager for maybe 3 or 4 months. But ideally, when we get to the next phase 2 budgets and we get the whole picture, you'll see that that position will be, for the entire lifetime of the project period, and that months or FTE will have increased. I'm definitely going to walk you through that process in much more detail come September, but in the interest of time today, I wanted to just prep you all for what the application review looks like. And we will go ahead and move forward to kind of the projections piece and do a bit of a deep dive there. Next slide, please, Kelly. So for those of you who are well versed in House Bill 3069, this will be old news. But for those of you who need a refresher, the commission is required to provide historical data to each applicant and to assist those applicants in developing a program population projection. This is all part of that phase 2 process. But as you saw in that timeline, we're in the middle of that TA work right now, and we are, busy preparing these applicants to make those projections in September, so that you all at the commission can begin, begin crafting and formulating the new formula that is described here. So applicants will develop the program population projection, and that will consist of a projection of individuals eligible for deflection based on their local program criteria, a projection of the individuals to actually be enrolled in their programs within that local jurisdiction, and an explanation of their methodologies and how they used, data sources to kind of calculate their projection numbers. Then the proportion of funds available to an applicant will be determined by the commission using those projections of potential populations served by the BHD program. Next slide, please, Kelly. So right now we're in the middle of that technical assistance that I mentioned. The CJC's research team is hosting one-on-one meetings with counties and consortia. And they're walking these folks through the historical data that CJC provided to all of these interested counties. They're also hearing from the folks themselves, what are their program plans for this biennium, and answering any questions about what it's, going to take to complete these projections and the specific projections template that we'll be sharing with you shortly. In terms of the proposed projection data sources, our senior researcher Will put an amazing resource together for these folks with all of the potential data sources that he and Monica could think of, broken down by the different deflection pathways, as well as their relevant sequential intercept model intercept and details. And then the CJC crafted 2 different projection templates where folks are being asked to project those, total number of eligible individuals based on their local criteria and the number of individuals entered into their BHD program as projected. And those are, we'll also share kind of snapshots of what those look like. And depending on if you're operating one deflection pathway versus multiple deflection pathways, we'll kind of show which projections template to fill out. And all of that's supposed to be completed by applicants no later than September 19th. Next slide, please. So in terms of historical data being provided, or that has been provided to these programs, there is first the behavioral health deflection data that's been reported by grantees into the REDCap statewide database from June of 2024 to present. That includes the counts of referrals, the ineligible individuals, program entries, participants that are currently active in their programs, unsuccessful completions, and successful completions by month. That data has been reported monthly to date by grantees, but there was that final data pool, I believe, at the beginning of July. So it's kind of that June 2024 to July, like kind of year snapshot of historical data. And then we have LEDS data, which includes the counts of fingerprinted arrests by month for both PCS alone, as well as PCS that includes co-charges. And that co-charge data includes the counts of county-specific co-charges associated with the PCS arrests. And
Casey,
yes.
Can I ask a quick question about that? Mm-hmm. So how will you factor in counties that are accepting people with charges without PCS, like, criminal trespass or something like that, where there may not be an associated PCS charge?
Great
question. But these are
Solomon.
deflection eligible people and certainly counting in the numbers, or should be counted, I would think.
Yes. So I imagine that Kelly will be able to take over for me right now, since the clock did just tick to 2:55, and that is very convenient for me. But thank you for your time. I'm going to bow out, and thanks so much, Kelly, for taking over.
Thanks, Casey.
Yeah, sure. And actually, Chair Solomon, I feel like that's probably a good place to stop with the slide presentation as well. We had a few more detailed ones, but depending on time, you can jump into more details or not. But to your question, there, and actually, I'm going to answer and then we'll let Will jump in with more details if he thinks I missed the mark here a little bit. But we are having those TA meetings with counties, and then yes, to your question, if they say, hey, we're going to consider, for example, trespassing in the second degree, CJC, can you pull our cases for trespassing in the second degree? If those run through the circuit court, we can pull that additional information and provide it for the counties. And Will has had several follow-ups from those meetings to provide kind of more tailored data specific to how the counties are putting their program together. So I think there's been a good iterative process in terms of taking the time to kind of orient with the data and then modifying as needed for the counties.
Okay, and getting a little in the weeds here, what about if those cases are being run through municipal courts?
So we had a great meeting with Lane County where that was exactly the case. And we CJC unfortunately do not have data on the cases through the municipal courts. Now Lane County was able to just work locally to get that data from their court. And it didn't sound like that was too burdensome of a process. And so they were able to do that. So 4 counties where they've got a substantial number of misdemeanor cases running through a muni court, there is potentially that kind of extra step of working with the muni court on that. Hopefully that muni court's also involved in the deflection program, not necessarily running it, but in terms of some of those other processes. And so recognizing the value of that partnership, I think would help there.
Great, thank you. And Commissioner Freeman.
Thank you, Chair Solomon, and thank you for those questions. I've got a whole list of them. I'm not going to waste the time of everybody's today, but I like the fact that, you know, there's a bunch of different styles of how counties are figuring out how to do this best for their areas. But it does bring up those questions like you just asked and a whole bunch of other ones. And most importantly, it makes it really difficult to measure the success because of the different programs. So I'm curious, as this program moves forward over time, if there's going to be some kind of a thought about standardizing how the programs are delivered, or at least some way to measure the success of the programs. It's just kind of a challenge to look at when you're, you know, looking at granting this amount of money. And then you heard me ask earlier about, is there a nexus between folks that are going through this program and the lack of people that might be going to a drug court or some other type, you know, mental health court or some other court, specialty court, because they're successful here. So I'm say I could go on. Again, I like the program. I like the flexibility of the different counties, figuring out what works best for them, but it makes it really hard to evaluate.
Mm-hmm. Yeah, Commissioner Freeman, I'll try to be quick. I know we're close on time, but yeah, the counties have the flexibility really to set this up in the way that works best for them, and also that ability to set the completion criteria, which we've seen varies across the counties. Again, giving them the flexibility to put together the program they need. But then, right when we get to the point of, okay, well, so what are the outcomes? It does vary a little bit in that way. CJC is pretty good at working with administrative criminal justice data. So we do have plans to look at criminal justice outcome measures here. It's a little early to do that right now, but we can look and see for folks that entered deflection, completed deflection, did they have an arrest, you know, in 6 months, 1 year, looking at things like that. So to the extent that folks are avoiding involvement in the criminal justice system, we can measure that in a consistent way across the programs. And we think about, just came up earlier in this meeting, right? Looking at recidivism rates of specialty courts, we could do something similar here for deflection programs. And so we will be doing that, even though it will be, you know, with much more a variety in terms of how the programs run. Also, to the question that came up from Commissioner Freeman earlier, I'll just venture to say I haven't heard a county say, "Hey, we really got the same population going into treatment court versus deflection." So we'll keep an eye on that and see what those kind of participant counts are looking like there. We certainly don't want counties, we certainly don't want these programs to be competing with each other for participants, but I think we can keep an eye on that if the program criteria are looking pretty similar across those regards. So I just want to throw that in there. And I know we're at time.
We are, and I just want to make one more comment about that. As you begin looking at things like recidivism data or arrest data, I would caution against measuring effectiveness solely based on additional arrests, because these are high utilizers of the criminal justice system. So I think it would make more sense to look at frequency or numbers of arrest versus a sole incident as counting as a failure or a recidivating event, given the population that we're talking about.
Thank you, Chair. Makes a lot of sense. I did have one quick agency staff update for commissioners that haven't had to jump off right at 3, which is just to say, and I think this meeting's made it very clear, we're at the grant award decision season, and it can be a sprint. So just a reminder to everybody that the next meeting on the afternoon of September 16th was extended an hour. It's scheduled from 1 to 4. So just a note on that. And then if folks do have any scheduling overlaps or challenges, please reach out to Jenny right away. And we will have, I'm sure, a pretty busy meeting for you all on the 16th.
Indeed. Well, thank you all for your time and stretching beyond. I hate meetings that run over, but we're pretty close to time. And do look forward to the next meeting. Please take a look at the materials in advance because we've got a lot of ground to cover in the next meeting. And thank you all for your time and your service, and look forward to seeing you at the next meeting.